Hey, this is Dr. Buzz with Buckeye Physical Medicine Rehab. BuckeyePMR.com is the website. On today's show, I brought a guest. He's lost 80 pounds in the past year. Amazing, amazing story. So we're going to talk a little bit about obesity and how to lose weight. I mean, it's a huge problem. So we're going to cut the break, and we'll be right back. Okay. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. And today we're going to talk about obesity. And I actually brought a guest with me, Kevin. What's up, Kev?
Oh, not much. How you doing, Dr. Buzz?
And Kevin actually has a deeper voice than me, so I'm adjusting. But anyways, we're going to talk about weight loss today and obesity in particular. And I'm going to start off the show by just talking about some stats and some statistics. And the reason I want to start off with this is, if you're listening to the show and you're obese, you're not alone. According to the World Health Association, the U.S. has the highest percentage of overweight adults in the English-speaking world. 74% of the U.S. population, adult population, is considered overweight. 74%. Think about that. 2 out of 3 American men are considered overweight or obese, and rates for women are even higher. And here's a scary thing. 17% of American children and 63% of teenage girls become overweight by the age of 11. So, and the reason I want to point that out is a lot of times it's a family thing. So if you're a parent and you're overweight, that's what your kids see, and it leads to them being obese also. The average obese person in America incurs an additional $1,400 per year in additional medical expenses. So think about that. If you're obese, which 74% of the population is, it's going to cost you on average $1,400 more a year in medical expenses alone. And obesity has been cited as a contributing factor into 100 to 400,000 deaths in the United States per year. So that's 1,100 people die every day in the United States as a comorbidity of being obese. Think about that. That's 4 or 5 jumbo jet crashes a day. So this is a huge, huge problem because obesity leads to type 2 diabetes, hypertension, stroke, heart disease, Alzheimer's disease, certain types of cancers, arthritis. I mean, the list goes on and on and on. So it's a huge, huge problem. And I can't tell you how many times people, a lot of people just think they can't lose weight is a sad thing because they've tried diets that don't work and they just don't know how to diet and how to lose weight properly. And that's why at Buckeye we came up with our accelerated medical weight loss program because it was a huge problem. Obviously at Buckeye we started out as a facility that treated people with aches and pains. Well, if you're obese, you're more likely to have joint pain. It's going to wear and tear on your back and on your hips, your knees, you name it. And it doesn't matter what type of physical therapy, chiropractic, massage. If you're overweight, it's really hard to stay out of pain. It is what it is. On top of all the other disease conditions it causes. So that's what we came up with our program. And I brought a guest, Kevin, with us today. Hey, what's up, Kev?
Not much.
Kevin has gone through our program, but I want to kind of start off with everyone has their story. Of how they got, what caused them to put on weight, and some of the stories, a lot of people, what I see at least, is people eat as a coping mechanism. So something happens at some point in their life, something changes, and, they eat as a coping mechanism and they put on weight. And then once they get the weight on, they can't get it off. And then all of a sudden, they're defined as this obese person and they're stuck with it the rest of their life. So tell us about you a little bit. So were you overweight your whole life?
I was a big kid, but then in high school I became a pretty successful athlete. I played water polo in high school and college.
You got to be in shape to do that, right?
That's right. But then my junior year...
Where'd you go to school?
I went to Purdue.
Okay. Wow, so you were pretty good then.
Yeah,
that's awesome.
Well, it was a club sport. It's not a varsity sport, but it was a lot of fun. I was president of the club.
Okay, cool.
Anyways, junior year, I got hit in the head pretty bad, and I started suffering symptoms of depression. And
was that an incident, water polo, or just something else?
No.
Okay, so you had a concussion or something. Okay.
Yeah.
Got it.
Yeah. So, where was I?
So you got hit in the head.
I got hit in the head, depression, kind of fell out of the habit of working out, and like you said, coping mechanism was substances and food. Food was the big one. And
so how much weight did you weigh? Like, so we'll say when this whole thing went down.
When it all started, and I quit working out probably about 220.
Okay.
And then last August, when I really I decided to make a lot of lifestyle changes. Really wanted to lose some weight. I was 330 pounds, 333.
So you went from 220 pounds to 330 in how much time?
Just under 4 years, I'd say.
Wow.
3 years or so.
Wow. I mean, how did that feel? Like, That's a lot of weight in a short period of time.
Oh, you feel a lot of shame, and you don't feel like the same person that you used to be, and that's tough to lose, especially I was a real leader, and losing all that confidence because I don't feel good about myself at all.
Was it gradual though? Like what happened? So this happened. Like did you put on like in a couple of months you put on a bunch of weight in the beginning, or was it just like?
No, it was. I mean, it was just pretty gradual because I fell into a lot of bad habits, I'd say.
What are some of the habits you had? Like what were like?
Oh, I mean, fast food 4 or 5 times a week. Spending tons of money on carry out, not working out, not getting enough sleep at night. You name it. I mean, drinking and just all sorts of stuff really affected it, and none of it was good for me. So it was kind of a wake up call when I started considering that.
What was the moment when you said, "Hey, this is it"?
Well, there's a lot of diabetes history in my family, and it was just apparent that was a real risk for me, and that was kind of scary. So, and then I just really my sister did the diet at Buckeye PMR, and she was really successful. Lost about 35 pounds.
So she was a guinea pig.
That's right. And then my mom saw how successful she and I were, and now she's doing it too. So.
Oh, fantastic.
Yeah.
So, but what happened? Did you just get up one day and say, this is it? Did you look in the mirror? Like, what happened? Like, what makes you, what I'm saying? What makes you say, hey, this is it? I'm not okay anymore being this way.
Well, honestly, it bothers you for like 2 years, 3 years, and you feel stuck, and you don't know what to do. And
had you tried the diet at all during that time, or do anything, or?
Sure. I had spent money to join a gym and never went, and my feet would hurt because I was so damn heavy, and I just couldn't get into a habit. And then really a family friend of mine hooked me up with a trainer in August, and that's sort of where
that started the whole thing.
Yeah,
fantastic.
Started turning it all around.
Yeah. So let's talk about your journey. So you got a trainer. When did you end up coming? And you saw your sister. She did the Buckeye weight loss program.
Mm-hmm.
And she had success.
Yeah, she did it last summer, I think,
okay.
And lost about 35 pounds. And then, what was your other question, sir?
And then basically she lost the weight, and then you saw her and like, hey, I'm gonna give this thing a shot.
Yeah. So I got my trainer in August, and so I was 333, and I was down.
Is that the top 333?
Yeah.
Okay.
Well, that's as heavy as I weighed myself. You kind of avoid the scale a lot when you're really heavy. But that I had to weigh in with my trainer when I started with him so we could track progress. So between August and January, I lost 30 pounds. I was at 308 when I started the diet, and then beginning of February, I started Buckeye PMR, and I lost 65 pounds.
How much time did it take you to lose that 65?
2 months.
Wow. Okay. So, and one of the things with our accelerated weight loss program is to help you lose weight really quick, because it's all about momentum. Would you agree?
Absolutely.
Yeah. So, in traditional diets, you lose 2 pounds a week, and that's not bad, right? But unfortunately, when you lose 2 pounds a week, people don't really notice it, and it's hard. And if there's a birthday party and there's cake, it's like, what the hell? And then the 2 pounds you lost during the week, you could gain literally in one sitting if you think about it.
So imagine 2 pounds a day.
Yeah. And that's what you're losing, 2 pounds a day on the diet. I mean, what did people say when they saw you?
People at the gym that I saw, 4 weeks prior didn't recognize me. Everybody at work commented on it. I mean, everybody notices.
Yeah.
Plus, I'm just a different person everywhere I go. I mean, it's just people really notice.
That's awesome. And then, was it hard? I mean, because people are probably listening to this thing. Number one, how old are you?
26.
So you're 26-year-old. You're 330 pounds. I mean, is this doable for people? Like, because a lot of people listen to the show and like, this guy, like, how hard was this for you?
Honestly, it was a little daunting going in, but it's kind of like following a set of instructions. You just do what's on the paper, stick to it, and it's easy. I mean, it's a struggle, sometimes, but you just persist and kind of get through it, and it's worth it. And when you see the number dropping on the scale
because you weigh yourself every morning.
Every morning.
Yeah. That's a key component. We tell you got to weigh yourself every single day. That makes you accountable.
Right.
You know what I'm saying? And with our weight loss program, we have a system to it, and if you don't lose weight for some time, there's a protocol you follow, which is cool. So because we had another lady supposed to be on the show today, and she canceled the last minute. She'll probably be on next week. But she was talking to me today, and she's had really good success. She lost 20 pounds in the first 10 days, but she's like, the last 2 days I've been stuck. And like, are you doing the protocol? She says, what's that? And I said, go back to your manual, read the protocol. So she's going to do a steak day today, which is cool,
I'm off the diet and I did an apple day yesterday. So
Okay.
I still do it sometimes, you know?
Yeah, and the key thing for anyone dieting is, you got to weigh yourself every single day. That's going to make you accountable. And it also teaches you if you eat certain things you shouldn't be eating, you're going to catch it the next day on the scale.
Absolutely.
So, you know what I'm saying? So, like, a lot of people can't eat corn or dairy, and if you have it, you would notice, hey, man, I put on 3 pounds yesterday. Hey, that's a no-no. You can't. Your body's going to hold water or whatever. And I want to talk a little bit about the diet so people understand what the Accelerated Medical Weight Loss Program is. And there's several components to it. And the first thing is diet modification. Mm-hmm. No matter what diet you do, you have to learn how to eat properly. There's no diet out there where you're going to buy shakes or eat candy bars or like those things you see on TV. Like that's just not real, because at the end of the day, you have to learn how to eat properly with real food you can go buy at the store. And with Buckeye, we give you a diet or a list of foods you can eat, and they're nutrient-dense foods. Were you hungry?
Really, no. I mean, with all the supplements and stuff that they give you in addition to the diet, you don't feel malnourished.
Yeah. So we give you really nutrient-dense food to eat, and you save money because you just go to the store and buy it.
Oh, yeah. Well, yeah, and I was spending tons of money on drive-through anyways, so, I was saving just going to the grocery store more, and it was, yeah.
I always tell people, and maybe you can agree with me or disagree on this here, when people are sitting down and we're going to the diet, and then we talk about the investment on it, it's cheaper to do the diet than not to do the diet for most people. Like, you actually save money during the time you're on the diet.
It's true.
You really do. So when people say, well, I don't want to invest this much of money, and it's not that much money. I mean, but when people say, hey, I don't know if I can afford it, say, number one, you can't afford not to do it for your health. But more important than that, like, you literally are going to save money when you're doing this, because you're not going to be eating out and eating a bunch of garbage. So you literally save money.
Not to mention the fact that I've reduced a lot of the medications that I was taking, which costs a lot of money. I mean,
what kind of medications were you taking?
The most expensive one that I was taking was blood pressure medicine, and that got cut in half once I finished the diet about 2 weeks ago. So
awesome.
I mean,
Good
that's
for you,
already a big savings. Thanks.
Yeah, that's awesome. That's awesome. Motivation for people. Were you taking any other meds? You're on blood pressure medication due to the way you're cut.
Well, with the mental illness, the depression that I was struggling with, I still take that kind of stuff. But the goal is to reduce those too. I mean,
I think you just had blood work done for hormones. You're going to get that done, right?
Right.
Yeah.
Right. I've been recommended to do so now that I finished the diet, and I've lost a person worth of weight almost.
Yeah, because what I mean, obviously I haven't seen your blood work. I don't know if you've done it yet or not, but anyone who is morbidly obese like you were, mm-hmm. your hormone system's gonna be messed up.
Yeah.
So, and you're probably gonna have low testosterone, high estrogen. It is what it is. Which the symptoms of those are the exact same symptoms as depression.
Yeah.
So hopefully the blood work doesn't lie, but if that's the case and we get that straightened out for you, that's going to help with that stuff too. For sure.
I mean, the difference in mood and the way that I feel is night and day. I mean, the numbers are nice, but I mean, that's what you get. Can't really put into words is how much better you feel.
You got a new life. Starting over and you're young, so it's no big deal. You share your experience. So, but step one is obviously the diet modification. Like I said, with our diet, there's no prepackaged meals or anything. We teach you what to go buy at the store. You go to the store, you buy it, and you cook it. And there's lots of choices, so you're not, like you said, you're not hungry or anything like that.
There's a few recipes in there too that they give you. So,
yeah, good stuff, right?
Yeah, it is.
The second component of the Accelerated Medical Weight Loss Program is we give you prescription strength lipotropics. And what lipotropics are, just so you know, is if you decrease your calories but don't take lipotropics, and lipotropics are things that make your body burn fat instead of muscle. Okay, so if you just quit eating and don't take lipotropics, you'll burn just as much muscle as fat. But the problem is you want to keep your muscle, because number one, this will give you your shape. And number two, the more muscle you have, the faster metabolism is. Mm-hmm. Which means the metabolism is how many calories you burn just when you're sitting around doing it, whatever. And a lot of people, when they diet, the majority of people, when they diet, burn more muscle than fat. And that's why the majority of diets fail. And studies will show you the majority of people who lose 10 pounds or more within 2 years gain that weight back. And the reason why is they burn up all their muscle, they slow their metabolism down. And then when they get off their diet, it's even harder for them to keep the weight off. So we really focus on keeping our muscle and burning fat, and we use these lipotropics. And there's a few we use. The first one we use is HCG, which is human chorionic gonadotropin. This is a naturally occurring hormone that occurs in men and females. But HCG, when you probably heard of it, in men it increases testosterone, which helps. But you hear about it for females because when females are pregnant, they produce a lot of it. That's why when they pee on the stick, the thing turns like a cross or whatever. You know what I'm saying? Because It is the elevated HCG. Now, when men or females take HCG, it doesn't make you pregnant, guys. You don't get pregnant, right? But what it does is the reason a female produces more HCG when they're pregnant is it gets the body to burn body fat for the baby, because the priority is to feed the baby when the baby's in the fetus. So when you give it to a male or female, the same thing happens. It tricks your hypothalamus into burning body fat first. And the other cool thing about it, I don't know, you might want to comment on this, is people usually comment that the place you burn it from is your deep fat store. So usually where you lose it last is where it burns off first. Like, so for some people, you know, if you're sitting here thinking, I diet, but I always have these stupid love handles, or my butt doesn't get any smaller. When you take HCG, wherever it comes off last comes off first. Did you notice that?
Yeah, absolutely. My gut was the big problem, and my love handles, you know, the big tire. And that's what really came off. That's what everybody notices, you know what I mean?
It's cool because a lot of people will, you know, you'll see people walking around, they're really lean, like their arms are lean, their legs are lean, but they have a gut. Because that's where it comes off, that's your deep fat storage. But when you take HCG, that's where it burns off first, which is really cool.
Yeah.
The other lipotropics we use, and these are all prescription strength. And the reason we went with prescription strength is, you know, if you get something from a pharmacy, you know it's regulated, you know it's tested, and you know it's pure and it's strong. And you know, this diet isn't, you don't do it forever. So we want to make sure you use as much weight as possible in a short period of time. So we use a prescription strength L-carnitine. L-carnitine is a naturally occurring amino acid that you have to have at the cellular level to get fat out of the cell. And we all know people who don't eat anything and they can't lose fat. Well, if you're deficient in L-carnitine, you can't get fat out of your body. It just doesn't. It won't happen. And a lot of people are deficient in L-carnitine. So we give you very high dose L-carnitine, and that assures you when you're on a calorie restricted diet, which you are, that you're burning fat, not muscle. And then we also use L-methionine, which is another naturally occurring amino acid that also at the cellular level pulls fat out of the cells. And the other thing it does that's very interesting is it also in particular pulls fat out of the liver, because what happens to people when you're obese is you tend to get fatty liver and fat around the pancreas, which makes you not use insulin properly anymore. And if you don't use your insulin properly, when you eat carbohydrates, bread, pasta, rice, they convert directly to fat. So we want to assure that you're using insulin properly and getting the fat off around your liver and pancreas, and that's what the L-methionine does. Mm-hmm. They actually prescribe for people that have cirrhosis of the liver, they take L-methionine because it helps detoxify the liver. So we give you an injection of that, and you're taking pills of that during the diet. So those are the lipotropics we use. And then we use appetite suppressant. And there's 2 prescription appetite suppressants we use. One of them is phentermine. Which one did you use?
Phentermine.
Okay. Phentermine's been safely used since the 70s. And a lot of people say there was a medication called fen-phen. Remember that? Maybe before your time. Yeah.
26.
Yeah, you're 26. Fen-phen was around probably... we'll say 10 years ago. So you'd been 16. Yeah, I probably went around then. But fen-phen was around. So phentermine's been around since the 70s. It's been used safely, effectively to help people lose weight. And how did you on your appetite?
You know, it wasn't so bad. I mean, if you keep busy, you don't really notice that you're hungry. And in fact, some lunches you have to force down. I mean, because you have to keep eating.
The main complaint I hear on the diet is not that I'm hungry, but that, man, I have a hard time getting my food in. And you do have to get your food in.
You got to get it all in.
Yeah. So the main complaint I have with the diet is, man, I sometimes have a hard time getting my meals in, but you got to do. Mm-hmm. So, but anyways, but phentermine, when the patent ran out on phentermine, they came up with another drug called fen-phen, where they took phentermine and mixed it with another medication, and the other medication causes heart problems and heart disease. So obviously they pulled that off the market, but phentermine is safe and effective, and that's what we use. For some people, we also use prescription strength Garcinia cambogia, and it really comes down to you sit down with the physician. We decide which one's going to be best. In your case, it was the phentermine.
My mom's actually taking the Garcinia. So,
people, it's
different strokes, different folks.
Yeah. And there's no cookie cutter on this diet, so we try to sit down, talk with the person, see what's going to work best for them. But the purpose of the appetite suppressant, that's the least important ingredient, but we do that to make the diet easier. Okay. And then the final component of this whole thing is making sure that you have a coach and you're accountable. You come to the office once a week or check in, because no matter what diet you do, you have to be accountable to somebody. And you got a trainer too. Like that right. Accountability is key. You know, getting up and weighing yourself every single day is key. Like you gotta be on top of this thing.
That was the other thing about starting the diet too, is I couldn't do it myself. You know, that once I got to that point, you know, then right. What you just said with the accountability is absolutely true.
It's so important. It's so important. That's why you know coming for your weigh-in or checking in, and sometimes you'll have issues. Like, did you ever like I was talking to the girl today, like if you get stuck on this diet, you should lose literally a pound at least a day. So if you go a couple of days and don't lose a pound or two, then you need to check in with a coach and we'll talk through, because it could be something you don't even think of you're doing. I mean, like, people make mistakes.
Right. Well, and one of the risks is that you go so deficient on calories that your metabolism slows down. And,
Correct.
And so that's why they're there. So
Yeah.
you go in, you tell them exactly what's going on, and you just carry on.
Yeah, 100%, 100%. Because, obviously, what I tell people is there's two ways we judge this diet, or how, I consider it successful. Number one is obviously losing weight fast. I mean, that's what everyone wants to do. But more important than that is keeping the weight off. We don't want people coming back to Buckeye every year and redoing the diet. That doesn't make any sense. That's why we teach you how to eat properly and all these other things, So we don't have people coming back and redoing, losing weight, gaining weight, losing weight, gaining weight. That's because that's unhealthy. Mm-hmm. It doesn't make any sense. So we tell people, when you come to Buckeye, you're doing this accelerated program, we don't want to see you back. We want to get you to your weight, and then we don't want to see you anymore.
Changing your life.
Yeah. This is a life change. This is not some quick fad diet where you're drinking juice or eating protein bars to get in shape for a wedding and then put the weight on afterwards or something like that. This is a lifestyle change, but this is something you have for the rest of your life. And then the final component that we talk about is doing blood work at the end once you get down to the weight, to make sure there's no other metabolic issues going on. Do you have any thyroid issues, testosterone, estrogen dominance? Because if you have a hormonal issue, it will be hard to keep the weight off. And that's included in the price of the program, a complete blood work, just to make sure that there's no other thing there that would prevent you, from keeping the weight off, for the rest of your life, basically. So, but if it's diet modification, prescription lipotropics, appetite suppressants, coaching, and complete blood work, this is what makes this diet work. And we've literally had thousands of people go through the diet at this point with amazing, amazing, amazing success. So if you're listening and you want to lose, 20, 30, 40, we've had people lose well over 100 pounds. Fast, we're talking a pound a day. This is the diet for you. It works every single time. It's completely affordable. It's, in essence, it's free, because by the time you figure, if you cut off your garbage,
the savings
it's free.
on all, yeah.
It's free. Like we have a free diet that you're going to lose all this weight, and anybody can do it. It doesn't matter what age you are. It doesn't matter how big you are. Anyone can do this. So, you're the patient. Maybe what advice do you have for people if they're sitting listening? Because people are listening, like sitting, I think it'll work for it. Yeah. Like what got you to make the step, and what can you tell people? Like how has it changed your life? What's new? What's different? How do you feel now?
I think the biggest thing that I got back was feeling like I confidently lead people again. That's kind of an intangible thing, and it was a hard thing to lose, and so it all just has kind of cascaded into feeling much better and just progressing forward. And for me, I was stuck for a long time, for 3 years, just trying to get well, and then you get kind of you could either get complacent with that, and then after that you get sick of it. And so the actual I can't really think of the actual moment where it was like,
there was no moment. There was no one moment. There was
no one moment where it was like, I gotta, it's time to change. But it was more like more opportunities presented themselves, and I just kind of rolled with them. And that's another good feeling that you get is just the momentum, like you were talking about, and just that alone is really,
it feels good when people are like, "Hey man, you look great."
Yeah, every person that notices it really makes you feel good.
Yeah, that's amazing. Well, hey, I really appreciate you coming on the show today and sharing your story.
Yeah, thanks for having me.
Yeah, if you're listening to the show, it doesn't cost you anything. We don't charge you to come in for a consultation. You can hear what the program's about, see if it's right for you. I mean, is it pretty simple to come to the office?
I mean, I don't know how close or how many locations there are, but there was one within 10 minutes of my place.
Yeah, you can either go to Gahanna or Grove City, or the two locations we do the accelerated medical weight loss program. But
so I was in Gahanna.
Mm-hmm. Yeah, and just go to our website, which is Buckeye P as in Paul, M as in Mary, R as in Roy.com, and come in for a free consultation. You have nothing to lose. Well, actually, you do. Wait, but no pun intended. But you have nothing to lose. Come in, hear about the program. But the majority of Americans are overweight, and you don't have to be. And it's not about being vain. It's about your health. And if you're a parent, it's about your children's health. So it's very, very, very important. Nothing's more important than your health. And the number one cause of people losing their health is obesity. So, and there's no reason to be obese. You can beat this thing. Anyone can. Kevin, thanks so much for coming on the show.
I would say if it sounds appealing at all, you should do it.
Just check it out. Well, thanks so much. This is Dr. Buzz with BuckeyePMR.com. Until next time.
Thanks.